We were talking about ama, and then we stopped for the lunch break. We explained the signs and symptoms. We briefly talked about the treatment also. Now, what happens is when ama mixes with the doshas, it gives the signs and symptoms of the sama, which is doshas mixed with the ama. Similarly, sama dushya, which is the dhatus, and sama mala, which is malas mixed with the ama. This we have already spoken, that in case of ama, treatment has to be done to digest the ama. Now, if we look at the signs and symptoms of samavata, the first and foremost symptom seen is vibandha. Vibandha means stopping of movement of mala, mutra, and vayu, which is urine, feces, and the flatus. So that is the first sign of samavata. So whenever the ama combines with vata, these signs and symptoms will be seen. Now, we have to remember one thing, that pitta and kapha can be physically seen in the body. So the actual mixing of ama with the pitta and kapha is possible. Whereas vata is known from its action. So the impact of ama on the vata, or the mixing of vata with the ama, can be seen from the actions or the effects only. And that is why there is a specific term used, which is upastambhita, which means obstructed vata, and nirupastambhita, which means non-obstructed vata. Obstructed vata is that which is mixed with ama. Non-obstructed vata is that which is not mixed with ama. That is the term used by Charaka. Whereas pitta and kapha, they can be physically, they will physically mix with ama and show the signs and symptoms. So that's the difference between sama, vata, pitta, kapha as such. So vibandha, sama, vata signs and symptoms will be stopping of the movement of feces, urine, and the flatus, which is the wind. Agnimandya, weakness of the Agni. Gargling noises in the abdomen. Abdominal pain. Edema, that is swelling. Pricking pain in the body, pricking pain in the abdomen. So as if somebody is pricking needles. So pain like that. Pain in different parts of the body. So like we said, the pain will keep on shifting, pain will keep on moving, those kind of pain. That is basically sama vata signs and symptoms, where, these are the signs and symptoms of sama vata. So whenever somebody is saying that I have pain in different parts of the body, you will have to, which is a shifting pain, which is a moving pain, you have to understand that this is a condition related to samavata. First digest the ama and then pacify the vata. If somebody is saying that there is vibandha, which is stopping of, all the movements, the mala, mutra, feces, they are stopped, then digest the ama, pacify the vata. That would be the line of treatment, or the way you will deal with it. Now, Samapitta shows different shades of green, black, and blue. So, different shades of green, black, and blue. Where will this be seen? This will be seen on the skin. This will be seen on the nails. This might be seen, in the urine, in the feces. So, the body will show different shades of green, black, and blue being shown, being exhibited in different areas, mainly skin, nails, etc. Amlarasa. So the mouth will be, there will be a sour taste in the mouth. Pitta will be non-flowing. So it will be sthira, it will be non-flowing. Heaviness in the body will come. So pitta is not heavy in nature, but because of the ama, pitta will become heavy and heaviness in the body. Bad smelling. So the bad smell, they have indicated that fishy smell or bad smell will happen when there is sama pitta in the body. Causes burning sensation in the throat and chest. Burning sensation in the throat as well as chest. So similar to reflux. When treating sama pitta, we first use ushna and tikshna substances, even if they are pitta increasing. Once the ama is removed from the pitta, then we can use sweet, bitter, astringent substances. So understand that in case of samavata, you had used ama digestion first, and then pacified the vata. In case of samapitta, first you have to digest the ama. So even if For digestion of ama, you need heating properties, tikshna properties, which are pitta increasing. You will still use those properties because first you have to digest the ama, and then you will use the properties which are anti-pitta, which is sweet, bitter, astringent substances, cooling substances to pacify the pitta. So they have very clearly said what I mentioned earlier, that when there is presence of ama, do not worry about the dosha, because at that time dosha aggravation is not important. That time pacification, or sorry, digestion of ama is more important. So even though the properties may be opposite to the dosha aggravation, you still have to use those properties. Then sama kapha, the kapha becomes turbid, it becomes sticky, and that's why it will stick to the throat, it will stick in the channels, and and cause obstruction. It will cause cough, it will cause problems in expectoration, it will cause problems in the mucus secretion, string-like appearance to the kapha with bad smell. So the kapha, the mucus will become stringy, it will stick, and it will also have a bad smell. Loss of appetite. Person will lose the appetite because the kapha and ama both are similar in nature, and that is going to actually cause severe loss of appetite and heaviness in the body. Burps with smell of food. So it's a symptom of indigestion. Indigestion will give you the smell of the food in their burps. So that will be seen. When ama mixes with kapha, pitchila property of kapha is disturbed. It becomes sticky and stringy, resulting in the signs and symptoms observed. So kapha mixing with ama in the body can cause these symptoms. Again, in this case, first digest the ama, then look at the kapha. Luckily, the properties required for digesting the ama and those required for digesting the or pacifying the kapha are same. So it helps. It works well together. It is not like antagonistic properties. So you have to be worried about it in terms of the way it is in case of pitta. Now, Samadushya. Samadushya is Samadhatus. Now, specific signs and symptoms of Samadhatus are not explained. Why? Sorry? Specific, Sama Rasa, Sama Rakta, Sama Mausa. Why they have not been explained?
Is it because they show up differently in different people depending on what their weakened tissue was?
Think about it. What will what does what is the difference between aggravation of doshas and the disease? The difference is the aggravation of the doshas combining with the weak dhatus is what results into the disease. Okay, so when the dhatus become sama, when the dhatus become uh, aggravated, dhatus become or dhatus combine with ama, they will result into various diseases, and that's why specific signs and symptoms of the rasa rakta mausa meda have not been explained, because they will be all different kinds of diseases that will happen pertaining to that particular dhatu. And that is why specific signs and symptoms of the samadhatus have not been explained in the textbooks. The generic ones are these ones, what I told earlier. The generic ones are these: obstruction, efficiency and strength reducing, etc., etc. But specific of rasa, rakta, mausamed have not been explained, because according to them, when the ama combines with the dhatus, it will give rise to diseases, which is what is going to be the signs and symptoms will depend on the disease that is formed. So depending on the dhatu, different organs will be formed. Depending on the organs, different systems will be formed. And depending on where the problem is, the signs and symptoms are going to vary. So for example, Rakta dhatu forms liver also, forms lungs also. The liver, the Rakta dhatu is responsible for formation of liver also and formation of lungs also. So if the ama goes and affects the liver, it will show different diseases in the liver. If the ama goes and affects the lungs, it is going to show different diseases. So it is impossible to explain signs and symptoms in form of signs and symptoms of dhatus, because dhatus are going to result into formation of organs and the systems. And then when the ama goes and accumulates or aggravates or combines with these systems or the organs, it is going to result into diseases which will have specific signs and symptoms of that disease, which will be studied in the diagnosis of various diseases as premonitory signs, signs of disease, symptoms of disease, and then the complications of disease, etc. So that is why they have not been explained here as specific. These are the generic ones, but very generic, which will not talk about any specific dhatu being affected. This is the overall body situation. Then again, Samamala, they have explained. Samamutra, they have explained. So Samamala causes guru, heaviness in the feces, foul smelling feces, loose or not well formed feces, you know, liquid feces, feces which sink in water. One of the things that we have to remember as generic in this case, generic signs and symptoms is also sinking stools or floating stools. When there is ama in the body, the stools, they will sink in the water. Okay, also coating on the tongue, which has not been explained in the signs and symptoms, but coating on the tongue will also be seen as a sign and symptom of ama, which is explained here. So, samamala will sink in the feces. It will be heavy, foul smelling, not well formed, loose. Now, tell me one thing. Have you, or I don't know whether you have seen, but I would rather put it the other way around. I'll not ask you as a question because maybe you're not seen people, but that many people. But though the stool sinking in water has been explained as one of the signs and symptoms of ama, the real signs and symptoms of ama vary as per the degree of ama in the body. The first and foremost is, foul smelling stools, sticky stools. These will be first seen. Okay, stools which are loose, stools which have undigested food in it, and then also stools which sink in water. So the varying degree will be seen depending on how much ama is present in the body. Sinking stools may not always be seen, but sticky stools, stools which are very difficult to flush, you need a lot of water to, clean the pot as well as, clean yourself. So those will be the ideal signs and symptoms for ama formation, which will be immediately seen. Sticky stools, foul smelling stools will be immediately seen as one of the symptom of ama in the body. Now mutra, again, foul smelling, strong smelling urine, turbid urine, which turbid means it is not clean, it is not clear, with precipitates, more viscous, it is thicker, higher specific density. When you pee, you can see probably uh, a layer on the water. Those kind of things will be seen. You can see turbidity in the water after you have urinated, if the person has urinated. So those kind of things will be seen where the clarity of the urine is lost. Even though the urine may be yellow, but it has to be clear yellow. In such cases, it becomes turbid. It becomes as if there are some particles in it, as if it is smoky, as if it has got some different shade to it, slightly opaque. So those kind of signs and symptoms will be seen in case of mutra affected by ama, sorry. Then the next concept that we are quickly going to talk about is dosha paka and dhatu paka. The idea here is very simple. Dosha paka means digestion of the doshas. Dhatu paka means the digestion of the dhatus. Paka means digestion. Dosha, Paka, digestion of doshas, digestion of dhatus. Dosha Paka is beneficial to the body. Dhatu Paka is not beneficial to the body. Dosha Paka helps in pacifying the doshas and establishing equilibrium. Dosha Paka helps pacifying doshas and establishing equilibrium, whereas after dosha paka, dhatu paka starts, which causes the dhatu strength to be lost, reduced, and increases disequilibrium, causes structural and functional changes in the dhatus. So, in simple words, dosha paka is basically pacification of the doshas. Dosha paka means pacification of the doshas. After the pacification is done and you continue doing the same treatment with the Agni, then that Agni, because of the strength of the Agni, it is going to cause digestion of the dhatus and then result into weaknesses of the dhatus, strength of the dhatus reducing, structural weaknesses coming in the dhatus, etc. This concept is briefly explained here. When we talk of specific conditions, we will talk more about this in details as to how this exactly happens at that time. These are just some dhatupak symptoms. Power and concept, I will talk later on separately. I'm not going to talk about it right now. Dosha gati. Now, dosha gati means there are different types of movements that happen in the doshas in the body. Those are explained under the dosha gati. So one is the kshaya, sthana, vruddhi. Kshaya is reduction in the doshas, sthana is the normalcy of the doshas, and vruddhi is the increase of the doshas. So this is one of the changes of the doshas in the body. Then the second movement direction is urdhva, upward movement of the doshas, downward movement of the doshas, and sideward movement of the doshas. This also is another type of movement. Now, what does this mean? Downward movement is apana functioning downwards. Diarrhea, loose motion is excessive functioning of apana downwards. That is basically downward direction of apana, excessive movement. Urdhva is upwards. If the apana starts holding things for longer duration, like constipation, for example, the holding power of apana is increased, downward movement is reduced. What will happen? The apana will hold, which is not the normal functioning of apana. And once it holds beyond a certain duration, then it will start creating upward movement of apana, which will then cause upward pressure on the diaphragm, on the lungs, and resulting into upward pressure on the prana and udana. So a lot of times you see people are showing signs and symptoms of coughing. Okay, they have cough. When you start analyzing why the person is having cough and you start giving them medicines, the person doesn't have phlegm, the person doesn't have any mucus formation in the body, doesn't have any kapha increase in the body. It's dry cough coming from where? Coming from the lower abdomen, coming from the pelvis. If the person is constipated, that constipation can cause the apana to function in opposite direction. Instead of functioning downwards, it will start functioning upwards, causing pressure upwards on the diaphragm, from the diaphragm on the lungs, from the lungs on the respiratory system, which means disturbing the function of prana and udana. Prana and udana are functioning in the same areas. So if that functioning is disturbed, friction in the functioning of prana and udana is caused, it will result into coughing reflex, resulting into dry cough without any signs and symptoms of any respiratory disorder, etc. There you give anulomana, there you give like a mild laxative, the cough will stop. A lot of times, stress causes coughing. A lot of times, stress can induce coughing. Again, dry cough. What happens? Are you aware of this concept that we have two types of breathing happening in our body? We breathe in two ways. There is something called as thoracic breathing, which is that we breathe through our lungs, and something called as abdominal breathing. That is, we breathe through our abdomen. If you have observed the kids, the small babies, observe their tummy. Their lungs are not inflating and going down. Their tummy is inflating and going down. Do we see in adults? We don't see it in adults. So our lung capacity actually depends on how much we are able to use our thorax and your abdomen to breathe. Better the lung capacity, better the ability to breathe properly, better the supply of prana to the body. As we start getting older, meaning as we start growing, and as we start getting various issues like stresses, etc., our abdominal muscles start becoming tight. As they start becoming tighter, our abdominal breathing capacity starts reducing. As it starts reducing, our lung capacity also starts reducing. And when we are stressed, what happens? The abdomen goes into a state of contraction. The abdominal muscles tighten up. The first thing to happen when a person is stressed is we tighten up in our abdomen. What is that? That is further going to cause whatever 5-10% abdominal breathing was happening, 20% was happening, that is also going to stop. If that stops, you're suddenly contracting the abdominal area, you're stopping the breathing there, you're stopping the expansion and contraction there. We are causing obstruction in that area, resulting into upward pressure again on the lungs and also reduction in the lung capacity. And that can also induce a cough reflex that is actually caused because of stress. In these cases, asking them to calm down, asking them to breathe, doing yoga postures where they lie down on their stomach and do cobra posture, where the entire breathing is happening through the abdomen. In the cobra posture, in the bhujangasana, when you go into that position of cobra, your entire force, entire pressure is on the abdomen. You are breathing entirely through the abdomen. Your lungs are not breathing in that case. Try it and experience it. Your breathing is completely happening through the abdomen. It's a posture that improves your abdominal breathing capacity. So what does that do? Once the abdominal breathing capacity is improved, it actually stimulates your Agni. It also stimulates your digestive functioning. It also stimulates your peristaltic movements. Simultaneously, it increases your lung capacity. The better the lung capacity, the better you breathe, the lesser the stress. So whenever people are stressed, why do we ask them to breathe? Take longer breaths. Why? Because that reduces the stress. So these kind of postures or these kind of activities, basically, when stress is induced, that is also going to cause upward functioning of the vayus, causing friction between the functioning of prana udana, resulting into dry cough. We started talking about it coming from stress, how it can cause the cough. So please understand the underlying cause can be something else. We might be looking at something else, as the sign and symptom. But we need to go down to the root cause and understand the root cause and deal with the root cause. So wrong functioning of vayus becomes an important aspect to understand. A lot of times, functioning of vayus is, or how the doshas are functioning is very critical. Now, nosebleeds. Is bleeding through the nose normal? No. So it's a abnormal functioning of dosha where vata is causing the blood to be thrown out through your upper orifices, say nose. And you know what is one of the treatment given for nosebleeds or bleeding through upper orifices? Giving laxatives. Why? Because when you give laxative, you are changing the direction of vata. Instead of moving upwards, it starts moving downwards. If it starts moving downwards, the bleeding stops. So when you look at treatments, you will find treatments like this given in the textbooks, that for upper orifices bleeding, give anulomana. Laxative, I don't mean laxative where you have loose motions. Laxative is just mild laxative which will cause softening of the bowels and which will cause the direction of the vayu to be regulated downwards. So as simple as milk and ghee, as simple as black raisins and milk. So those kind of substances have been advised for conditions like this. Why? Because it's a abnormal direction of vata which is causing this. So the directions of vayu are very, very important to understand how they are functioning. And I am saying vayu because pitta and kapha cannot move on their own. They have to be moved by the vayu. And that is why it is the five pancha prana, five pancha vata, whose directions need to be understood, and always we have to check whether any of the directions has changed. I'll give you another example. A lot of women, they complain of menstrual pain before the menstruation. They complain of menstrual pain before the menstruation. And the typical symptom they show is the pain and the cramping is before the menstruation. As the flow starts, the pain reduces. What does this mean? It means that the pain was because of the obstruction to the flow. And that is why the moment the flow started, the apana started functioning in the normal direction, the pain reduced. So in these cases where specific symptoms are seen like pain before menstruation, and you see that the female is complaining that as soon as the flow starts, the pain stops. So it is before the menstruation, a day before the menstruation. So in those cases, what helps? Simple things like application of castor oil on the abdomen in a clockwise motion, application of hot water bag on the abdomen. What will that do? That will regulate the direction of apana, not let it obstruct the flow than what it is supposed to hold. What is happening here? If I'll come back to you, Doreen. Give me a minute. So if suppose apana is supposed to hold, say, for till 12 o'clock in the afternoon and the flow has to start in a normal situation, if that apana keeps on holding that menstrual fluid till 4 o'clock, that is abnormal. Now what is going to happen? Because it's holding there, the vata is going to start moving in the tiryak direction, in the sidewards direction, causing stimulus to the nerve endings, resulting into pain. So if you can just regulate the function of apana so that it starts functioning downwards at 12, which is what it's the normal time, you will not see pain, or the pain will reduce. Yes, Dory.
So, what is it when it's the menstruation pain start when the flow starts? Not before. When the starts, only when the flow arrives.
Yeah, so that is not because of obstruction. That is purely because of the vata aggravation with the artava dhatu. So there you have to constantly keep on giving, you have to correct the dhatu itself. You'll have to correct the shukra dhatu, you'll have to correct the artava dhatu. Because in these cases where there is pain, okay, you will have to also see what type of pain it is. Pain will be of different types. Okay, it will be either pain associated with nausea, pain associated with headaches, pain associated with backache, pain associated with cramping, pain associated with diarrhea. So those will indicate what are the doshas associated with the pain. If it is nausea, it is vomiting. If it is diarrhea, that is indicating pitta. If it is cramping, if it is just the pain, if it is headache, it's indicating vata. So it is the dhatu affected by the dosha directly, which is what is causing the pain. It will also show in terms of the quantity of menstruation also. Pain with smaller quantity of menstruation, pain with larger quantity of menstruation is an indicator of vata and pitta dosha associated with the menstrual fluid or the artava. So then accordingly, you will have to treat the dhatu and see if the dhatu is affected by that dosha itself and it is not related to the dosha causing obstruction. So in the earlier situation, there was no problem with the Shukra Dhatu. It was a problem with the flow of the Shukra Dhatu. In the second condition, it is not the problem with the flow or the Vata stimulus. It is the actual Dhatu that is affected by the dosha.
Okay.
Correct. So in the second condition, it is the dosha dushya samurchana. The dosha and the dhatu are combining together. So it is like a disease. So there you will have to break the bond first between the dosha and the dhatu, and then you will have to look at improving the quality of the dhatu. So that once the dhatu is improved, even if the vata aggravates, it will not cause other signs and symptoms except for probably obstruction and a little bit of pain, as indicated in the constitutional characteristics. Tendency to pain, tendency to nausea, tendency to clots, which is the characteristic features explained in the constitution. They are not the disease features. Clear?
Teach us how to manage and reach the dhatus throughout the year.
Sorry.
I believe that you will teach us how to manage with the dhatus then.
You did study Rasayan therapy in year 1.
Yes, but I think you have more to add on.
So where is the list? I'm waiting for the list.
Every classes, it seems like there is something to add on it anyway. So
No, but there will be few things like which, see, there are two things in this. One is a conceptual problem in understanding the concept. Like, there is absolute confusion. I have no idea about what this is. So that list at least has to come. Like for example, Elena asked me to, clarify about Dhatu Agnis. Now, Dhatu Agni is not expected to be learned in year 1 at all. Okay, Dhatu Agni is a concept that you learn in probably in advanced diploma only. But such type of things which you probably have read or heard somewhere or, studied somewhere, but the concept is not clear. At least give me the list of things. Otherwise, we'll be here doing 60 lectures, which I don't have a problem, but you come only once a week to the school to do my lectures, I mean. Yeah, but anyway, anyways, as I'm teaching, I'm going into details as and when important, because obviously, if you're going to study Nidan, if you're going to study diagnosis, if you're going to study treatment, I cannot just jump and say, okay, now this you have studied, I'm not going to touch upon it. I'll ask, if I see you don't know, I'm going to go and touch upon it at least to the extent I can. So, yeah, Rasayan therapy is what basically you need to understand. And Rasayan therapy is how you improve your dhatus. Now the question remains as to Rasayan therapy, to what extent can we do individual dhatus? Can we do individual agnis? Yes, I have said this earlier only, that I will give you as to how to improve dhatu agnis individually. End of the day, what is the reason why the dhatus get affected? First and foremost is your diet. That you can correct, right? That I don't need to correct. Your Agni, that you can correct, the Jatra Agni. So these two things are most important. Then at a deeper level, what happens? At a deeper level, you need to do two things. Specific nourishment of the tissues is what is going to cause the rasayana of that particular tissue. So what are the specific nourishments? We will study them for sure. And the next is specific problems with the Dhatu Agni. How to correct the Dhatu Agni of Rasa, how to correct the Dhatu Agni of Rakta. That list I will give you. So then you are equipped to do Rasayana. But Rasayana will be the way to deal with the Dhatus end of the day. And to start with, if you don't know anything, go back to the basics. Who is the controller of the Agnis? Your digestive Agni is the controller of all the Agnis. So strengthen the Dhatu, strengthen the digestive Agni, it will strengthen the Dhatu Agni. You may not be accurate, you may not hit the bullseye, but you will be probably, in that close circle around the bullseye. You may take probably 10 days more to correct it, but you will not go wrong. That doesn't mean I'm not going to give you the list. I'll give you the list, but even if you don't have the list, you forget the list, still strengthening the basic Agni is going to help you correcting the Dhatu Agnis. Then the next directions of functioning is Koshta, Shakha and Marma Sandhi Asti. Okay, this we will talk at some stage, eventually. And Chaya Prakopa Prashama, that is increase for aggravation and pacification in the natural condition. Now this Chaya Prakopa Prashama, basically, so Chaya is the first stage of disease progression, accumulation of the doshas. Prakopa is the aggravation of the doshas. Then comes the next stage, which is spread or circulation in the body. Then is the fourth stage. While circulating, they will combine with the dhatus. That is the fourth stage. Then is the fifth stage, where the disease is expressed, which gives you the signs and symptoms of the disease. And then is the sixth stage, where the complications of the disease happens. So the Chaya Prakopa Prashama is the natural phenomena. Doshas increase, further increase, body will give you the signs and symptoms of opposites. If you follow that, the doshas will pacify. If you don't understand, you continue doing it, it will continue into the third stage, fourth stage, fifth stage, and sixth stage. That is what is the Chaya Prakopa Prashama. Again, 6 stages of disease progression we are going to study in details, because you need to know what happens in stage 1, stage 2, stage 3, because stage 4 is when the disease is formed. That we are going to study separately as diseases. But 1, 2, 3, those stages, they also have signs and symptoms, which you need to know. Because if you know what happens in 1, 2, 3, you can understand those changes happening in the body and treat those changes before it reaches the stage 4. That is the idea of understanding of 6 stages of disease progression, right? The Western science today talks about going to the doctor when you see signs and symptoms, because they don't have the concept of stage 1, stage 2, stage 3. The premonitory signs of a disease, or the signs of aggravation of doshas, or the signs of accumulation of the doshas is not there in the Western science, which we have. So if we study those, then we know exactly, oh, this is accumulation of the doshas, I better pacify my vata. Oh, this is accumulation of pitta, I better pacify my pitta. So those also we will be studying when we study the 6 stages, and Prakrut and Vikrut Gati, which is the natural and unnatural direction. Now, what time is it? 11:10. Okay. So we will do one thing now. Instead of getting into the Srotasas, we will go on to study some herbs today, and then we will go back to studying the Srotasas in the next lecture. Okay, so Hillary, I'm going to log out here and log in, because I'll have to change the presentation.
Yes, if you do that, I'm also going to stop the recording so we get an individual recording of each herb.
Okay, perfect.
Okay, great.